So welcome to Lukeville PhD. I'm a psychologist here in Maroubra, Sydney, Australia. And I wanted to talk a little bit about, well, do I need a psychologist to recover from addiction? And there's a short answer. Well, no, not 100%, but there's also a more layered answer, and that's a yes and no. So first, you don't need a psychologist to recover in the same way you don't need an accountant to do your taxes. It's a technical role, but if you're willing to teach yourself, then of course, you can attempt that. Now, I think a more useful question: will my recovery benefit from engaging with a psychologist for support, for the mental skills required to recover and to abstain, and also to prevent relapses from addiction? The bottom line is that you still have to do all of the work. You don't recover if someone else does all the work. Now, I have about, 6 questions in this blog post that talked about this particular issue, and it's worth actually sharing that. So if you say yes to a few of these, you might benefit from having a professional mental health service provider. Okay, so question 1 is, have you tried repeatedly to quit and fail? And so if you're frequently finding yourself trying to quit, or promising that you'll quit, or you might quit for only a day or two and then you start back up again, that's one sign. Okay, question 2. Have you relapsed? Is this multiple relapses? So if you have relapsed, it might be something that might be triggering this, or it might be that your plan that you put in place to prevent relapses or to address lapses isn't quite refined enough, or you're missing a skill, or there might be some barrier. So that's another sign of when to engage in treatment with a psychologist. Okay, so question 3. Do you lack support from your family and friends? Now, depending on the systems that you have around you, your family and friends might not be that supportive of you making an effort to recover, or they might be very judgmental, or they might be, you might have interpersonal conflict, or your addiction might have already strained some relationships, so it's sort of difficult to rely on them for support. Okay, question 4 is that, are you the type of person that has difficulty motivating him or herself? It's very challenging to take on recovery from addiction on your own. And so if you're already sort of ambivalent, or you're not quite motivated for treatment, then it's worth actually talking to a psychologist, because what we can do is we could build the motivational resources so that they'll help propel you towards action. Question 5 is that, do you have other things in your life that require your attention? Do you have other life challenges? Are there other things that need to be worked on? Because again, recovery is really challenging. This idea that we can do everything at once, it's really tough. And we might put really unfair expectations on ourselves. Now, the last one is, and this I think is an important one, is that, well, do you want professional support? So that you can focus on your recovery. There are just some things that are just preferable to have a professional sort of support and guide you and develop the skills necessary for you to recover and to stay in control of whatever your problem is. The best way to think about this is that the right professional will lead to a better result. And recovery is already challenging. So, this idea that, okay, we can, even though we can do it on our own, it's really up to you whether or not you want to take a DIY approach, or like a solo recovery approach. And that's perfectly fine. Lots of people do that, and I 100% support that. In fact, you can visit lukevuphd.com.au. In the resources list, there's lots of materials there, a lot of self-help materials, and also a couple of guides on how you would engage in a solo recovery effort from gaming addiction, from porn addiction, from gambling, and also from substance use. Now, the alternative is that, well, you can choose, you can decide to work with a professional so that you save the time and, importantly, you minimize any excessive suffering. And that's the key here. If it takes you 6 months longer, sort of trying to figure this out on your own, you'll get lots of learning lessons, but that's 6 months longer of really struggling, sort of feeling stuck. And when you're not making progress, it feels exhausting. Other than that, I hope that helps, and yeah, happy recovery. Have a great day.